740, we want to welcome to the program Dr. Paul Offit. Good morning, sir. How are you?
Good morning. How you doing?
I'm not doing too bad. Where in the world are we talking to you from? Where are you at?
Well, right now I'm in Avalon, New Jersey.
Oh, okay. And how's New Jersey this morning? Are you guys still under the same restrictions that you've been for this time period of the COVID-19?
Yes. No, I'm here with my wife, my daughter, my son, my daughter's boyfriend, my nephew, his pregnant wife. So we have like 7.5 people here. It's like a commune.
And there you go. Were we like all together, and then it's like nobody go anywhere, and it's like, damn it, they didn't get out of the house in time. So, Doctor, you got...
No, there's pretty much nowhere to go, actually. So I feel sorry for my daughter's boyfriend. He's like in a Scared Straight program for being part of our family.
He's either going to be accepted or he's going to be out of there as soon as the doors open. You've got a book out. It's called Overkill, When Modern Medicine Goes Too Far. And you've been known to have a good insight that might be out of the norm on medicine and the use of medicine and maybe the overuse of medicine. In one line, do you think our modern medicine just has gone too far in many different directions of the use and what we have and what we do and whether it's really needed?
I think the purpose of the book was to sort of go through those situations in modern medicine for which there's abundant scientific evidence that we shouldn't be doing something, but we do it anyway. It was surprising to me, for example, that you don't need to finish your antibiotic course, that fever is of value, that treating fever prolongs and worsens illnesses, that prostate and thyroid screening programs don't prolong lives. And the purpose of the book is to try and get people to be better advocates for their own health by at least knowing the studies that are out there. Studies that are often supported by advisory groups, but it's just sometimes ignored by physicians.
Well, let me grab a couple of those topics that you just mentioned that are in the book. Like the treating the fever. We always, what is it? Treat the fever, feed the cold, feed the fever. So if a fever is going on, just let it, are we supposed to let it run its course and not try to reduce the heat and so forth that the body is doing?
Yes, so the question is, why do we do it? I mean, we everything that walks, crawls, swims, or flies on the face of this planet can make fever. There's a cost for fever. I mean, we have to expend energy to make fever. There's a metabolic price for fever. Why do we all do it? And the reason is simply that our immune system works better at a higher temperature. I mean, if you're infected, for example, with this virus, with COVID-19, the way that you rid yourself of this virus is you make antibodies. These proteins in the blood that neutralize the virus. The cell in your body that makes antibodies are B cells. B cells work better at a higher temperature. They do. They make antibodies more efficiently with a higher affinity at a higher temperature than at your body temperature. So why treat fever? I mean, there's now many studies that have shown that when you treat fever, you can prolong or worsen illnesses, that you have a longer period of time during which you shed virus, a longer period of time during which you have symptoms from that infection. I think what people think is that if they treat the fever, that they're really making the infection better, which isn't true. They're just making the symptoms of the fever be less, which are muscle aches or headaches or shivering. But, your body makes fever for a reason. Don't work against your body.
Interesting. Now, you've got education and experience in vaccine developments. You were the Young Investigator Award in vaccine development from the Infectious Disease Society of America. Talking about COVID-19, where from your knowledge and your guesses and experience, would you say we are in trying to come up with a vaccine for this COVID-19?
Well, we'll make one. I'm confident of that. There's certainly more than 50 companies across the globe that are interested in doing this. So interest and money is not the problem. The problem is we just got the virus, so we're just trying to figure out exactly how to do it. Do you sort of take the virus and kill it, which is the way like the polio vaccine is made, or do you weaken the virus, which is the way the measles vaccine is made, or do you just take one protein from the surface of the virus, which is made the way the hepatitis B vaccine is made? Typically, the length of time it takes to make a vaccine is about 20 to 25 years. I mean, our vaccine was made in 26 years. That's about average. So to say that you're going to make it in a year or a year and a half means that you're definitely not going to be doing things that you normally do when you make a vaccine. And I wonder what that's going to be here. I mean, I wonder whether we're going to release this to the public without having done a large so-called phase 3 placebo-controlled safety efficacy trial that is then submitted to the Food and Drug Administration for licensure. Because if we're going to do that, which is what everyone always does for a vaccine and has done, then I can't imagine we would have a vaccine within 2 years. So when we talk about having a vaccine as early as the fall, which some people in the government are talking about, I mean, scientists in the government are talking about, then you would have to skip a number of steps.
Well, let me ask you this, Doctor. You're in charge. Would you do anything different now, in the past or in the future, in regards to how the reaction has been medically towards the COVID-19?
Well, I think the biggest thing is testing. I think, having more extensive testing to see whether you're infected, so-called PCR testing, or to see whether you're immune, so-called serological testing, it was the way to go. And I think Germany is the perfect example of this. First, aside from they've had really half the deaths proportionally than we have had. I mean, they're a population of 80 million to our 130 million, so they're smaller than we are, but proportionally they've still had fewer deaths. And now they're getting back to work. They're getting back to work by saying, here's the transmissibility of this virus in your territory, knowing, sort of what from PCR testing. Here's the percentage of the population immune in your territory from the serological testing. So I think this industry can go back to work, or this industry can go back to work. It's a thoughtful way of doing it. And that's pretty much the way Governor Cuomo is doing it in New York. It's not the way that, say, they're doing it in Georgia now or in Texas, where they're just saying, or it's Florida, let's just sort of go back. And I think we'll see to what extent there's a bump then in cases with that strategy as compared to Governor Cuomo's strategy. We'll see. I think we're learning as we go. Sweden is sort of a control group. Sweden never shut down. They continued to have, go to bars and restaurants and movies, et cetera. And they proportionally have the highest sort of rate of death per million people in the world by doing it that way. So clearly shutting down, sheltering in place and locking down does matter. We'll see how this plays out.
Well, let me, Dr. Offit, there's some talk that maybe this virus has been here longer than 60 days, that maybe in the fall or the winter, that maybe already traversed through portions of the United States, and people may already have some antibodies in there. What's your thought on that?
Well, I certainly think a much larger percentage of this population has been infected with this virus than we think. I mean, when they say things like there's 600,000 cases, that could be off by a factor of 10 or 20 or 50. We're already learning that from studies in Germany and Iceland, that a much larger percentage of the population was infected than they thought because it was asymptomatic infection. And usually you don't test people who are not symptomatic. You only test people who are symptomatic. So could it have been here earlier? Yes, I think it could have been. China was slow to let us know that there was a virus circulating in their community, a deadly virus. I mean, we shouldn't have had to have depended on a whistleblower to tell us that was going on. So could it have been here earlier? Yes, I do think it is spread through the population much more than we currently think.
And if that is the case, then there are a lot of people walking around that already have the antibodies in here that would be safe of reoccurring the COVID-19?
Yes, I think that's right. This is not influenza. This virus doesn't seem to mutate. It's more like measles, meaning it stays. They're all single-stranded, so-called single-stranded RNA viruses. I think this virus will not mutate. I think we can make a vaccine to eliminate it. How quickly we make it depends on how much we're willing not to do before we put it out there. But I certainly think we can make a vaccine that eliminates this virus from the face of the earth. I think that's certainly possible.
One last question. Do you think we need to wait until a vaccine is around, or how does life get back to normal? How would you suggest reintroducing normalcy to America?
No, I don't think we should wait. I mean, I think that, first of all, we're about to experience the second part of this public health disaster, which is the first part was obviously the virus can cause suffering and hospitalization and death. The second part is massive joblessness. It's going to lead to massive homelessness and all the attendant medical consequences of massive homelessness. So I know we do need to get back to work, absolutely. The question is how to do it in the smartest, safest way possible so we don't, again, overwhelm the healthcare system. I mean, the goal here is not to avoid any future cases or any future deaths from COVID-19. If that's the goal, then we should stay inside for the next 3 years. We can't do that. We need to get back to work, realizing there's going to be a bump in cases when we go back to work. We just want to make sure that bump doesn't overwhelm the healthcare system. So do it slowly. I mean, do it 1 foot at a time, basically the way Germany's doing.
All right. Dr. Paul Offit, thank you very much for joining us on the program. If you want to take a peek at his book, it's a good read. It's called Overkill, When Modern Medicine Goes Too Far. I could talk to you longer, but we got to move on. Thank you very much for joining us on the program.